So good afternoon, everyone. My name's Catherine Fuller and I'm the Assistant Director of the Post-Market Reforms and Reviews section in the Medical Device Surveillance branch of the Therapeutics Goods Administration. Before I start, I'd like to acknowledge the traditional custodians of the land on which we all meet today, wherever you are situated, and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islander people here with us today on this webinar. So thank you for joining us today to discuss the application process for consent to import, supply or export medical devices that are non-compliant with the essential principles. As this is a bit of a mouthful, from here on in, I'll just refer to it as the consent to supply form. The TGA is modernising this process to move from a standalone paper-based form to an online form. The transition has occurred in two phases, with the first phase being an interim online form hosted on the TGA Consultation Hub, and the second phase being the launch of a new online form which is integrated with your TGA Electronic Business Systems account, or TBIS as we call it, and the TGA Post-Market Compliance System. And this is the form that we'll be discussing in today's seminar. So today's webinar will be divided into a few parts. We'll go through some introductory slides and then a live demonstration of the new form in TBIS. Any remaining time will be dedicated to a question and answer session. The topics covered by the webinar today will be a brief introduction on why and when you may need to apply for consent to supply, and how and when to apply for consent, what the new form looks like, and what the TGA expectations are in regards to the information that you will need to provide. And then I'll touch on the process after you submit the application form, including the payment of fees. There'll be an opportunity for you to ask any questions that you may have. Please type your questions when the Q&A function is open during the presentation into the message box at the bottom corner of your screen. And we will try to answer as many questions as we can during the last part of the webinar. Please note that we will open the question and answer function after the live demonstration so that we have an opportunity to show you the form. If we're not able to get to your answers in the time allocated, we may need to come back to you on some of the questions. So please be sure to include your contact details when you post a question. Okay, so let's begin with a bit of background. The reason that you might need to apply for consent to import, supply or export medical devices that are non-compliant with the essential principles is because there are criminal offences under Section 41MA and civil penalties under Section 41MAA of the Therapeutic Goods Act if you supply non-compliant medical devices, unless consent has been granted by the Secretary of the Department of Health. Whilst the TGA expects and requires compliance with the essential principles, there may be some extenuating circumstances preventing compliance to one or more parts of an essential principle for a limited period of time. If this is the case, then you can apply for consent to supply the medical devices, even though there are some non-compliances. The TGA will review the risk of supplying the non-compliant medical devices with consideration to the risk mitigation strategies that the sponsor or manufacturer are going to put into place during this time. It should be noted that if your non-compliant device is currently part of an application to vary the device or manufacturer's evidence, or you have an application for inclusion in the ARTG and the devices are going to be supplied whilst non-compliant with the essential principles, you will still need to apply for consent. If you're seeking consent for supply of non-compliant devices, an authorised representative of the sponsor needs to complete and submit the relevant application form, which can be located from the Essential Principles Consent for Non-Compliance webpage. This webpage also provides you with a copy of the guidance document on how to complete the application form. In the application, you must upload or include all relevant documentation, such as the risk mitigation strategy and implementation plan, and then pay the applicable processing fees in full. The delegate of the Secretary will take all relevant information into consideration when determining whether to grant consent. A notification will be sent to the sponsor advising of the outcome. For those applications that relate to non-compliant patient information materials, these are deemed to pose a low risk of harm to patients and we acknowledge that the non-compliance may be a result of the differing time periods for implementation of the regulatory requirements between Europe and Australia. Therefore, we envisage that the processing time for these particular kinds of applications will be rapid, and the TGA will focus on ensuring compliance with the implementation plans post-consent. So the TGA is building a new integrated solution for the consent to supply for non-compliant medical devices, moving from a paper-based form to an online form, and then to an integrated solution. A few months ago, we developed an interim form on the TGA Consultation Hub to hopefully make the application for consent easier and more streamlined. We are now moving this to the next phase of the project, which is an integrated solution within TBiz. Neither the paper-based form or the forms on the TGA Consultation Hub will be accessible after 1 December this year when our new form in TBiz goes live. The new form will be hosted on the TGA Business Services site, or TBiz as I'll now refer to it. You would log in as you normally would for any other applications or adverse event reporting and then select the Applications drop-down menu. From here, you would select Medical Device Post-Market Compliance option under the Regulatory Compliance heading. Doing so will take you to the PMR Compliance Dashboard, where you can select the Consent for Non-Compliance Applications tile to access the next dashboard and start a new application. So now what I'd like to do is show you the form in TBiz and take you through an application. So I'm just going to share my screen. Okay, so you can see here that we are now on the PMR Compliance Dashboard, and you can see the Consent for Non-Compliance application tile that I just referred to. So if I click on this tile, it will take us through to the dashboard. Here you can see the Consent for Non-Compliance application dashboard. We have two views here. One where you can view draft consent applications that you have drafted but are yet to be submitted. Here you can also view any submitted consent applications. You can use the search function to search for any of your applications. You can do this by typing something into the search box and then pressing the magnifying glass, and it will bring up the search results. You can also return back to the view at any time. If you are doing a partial search, you just need to type in the asterisk character as a wildcard and type in a partial search, hit the magnifying glass, and it will do that search function. In addition to the search function, you can also sort the columns in order. You can do that by clicking on the column header, and what it will do is it will search it, order it in number. So you can do this by title, which will do it in alphabetical order, or you can do it by reference number and it will do it numerical order, and you can also sort on the dates that it was created. Here, when you've got your draft applications, you can use the drop-down menu to choose an application to edit and make your edits from there. But let's go through a brand new application. So to start a new application, I would choose the New Application button on the right-hand side of the screen. By clicking on this, it will open up a new window within the current view, and it will prompt me to create a name for our application. Now, this can be anything that is meaningful or relevant to you, but you do need to provide a name as it is a mandatory field. So let's just give this one a name. Once you type in your name, you just press save and close. Just processing. Apologies for my bandwidth here. Okay, so once it's done that, it's going to appear here in the draft application view. From here, you can see that it's generated a number, a consent to supply application number. And this is the number that you will need to refer to in any further correspondence with the TGA in regards to this application. Now, to start on this application, we basically use the right-hand drop-down button and press edit. And this is where we'll start filling in all the details for our application. This will take us through to the view here where you can see all the different application sections. Now, there's two ways that you can actually view the application. One is by expanding all the sections at once, and this will allow you to see all the questions throughout the application. Or if you would prefer to do it section by section, you can collapse all and then open one section at a time. That's what we will be doing as I go through this demonstration. You'll notice here that the tiles are all amber in color. What that does is it indicates that not all the mandatory information has been provided for this application yet. Once we've provided this, all the mandatory information, these tiles will turn green. So let's go ahead and start with the application details. By clicking on this section, it will bring up all the questions that we need to fill in for this part of the form. You can see here that it has already pulled in the consent to supply number that was created when we gave our application a title. You can also see that it has brought through the title that we named. In this box, you can edit the name if you've made a decision that the name wasn't exactly right. Here, it will also provide the sponsor details that is associated with your TBiz client profile in TBiz. The next thing is for you to select what application type you are requesting. Here, you need to select whether you're seeking consent to import, export, or supply these non-compliant medical devices. This is a mandatory field and you must select at least one. However, it may be appropriate that you need to select all three. So you can select 2, 1, 2, or 3. This is a mandatory field. The next question is whether the devices part of this application are actually devices that are currently included in the ARTG or part of a current application for inclusion. An application can be for both sorts of devices. This is also a mandatory field and you need to select at least one. Here, let's select both. The next question is around why the devices do not conform to the essential principles. The drop-down menu gives us a few options. Is this a result of the EU MDR implementation? Is it a result of the EU IVD implementation? Is this a result of the Australian regulation changes? Or if none of these options are appropriate, you can select other. If you select other, you must provide an explanation as to why these devices do not conform. You can just type your information in there. The next question is about what the real or potential risks associated with the non-conformance if the non-conforming devices were to be imported, exported, or supplied. And here you need to provide an explanation, and you can do this in two ways. You can either provide an explanation by typing in the box provided, or if you've got a document that outlines these risks, you can provide it here. So what I'll do is I'll show you by uploading a document. What I need to do though, if I'm uploading a document is, as this is a mandatory field, I need to write document attached in the box provided. So now if I want to add a file, basically it's going to ask me if I add files to choose a file from my computer. Here I just click in the choose files option here and it will open up the file explorer on your computer. And here you can select a document. It will list it here and then you can just simply press add files. And you can see here that it's going to upload a document here. You can see now that my tile has turned green, and this is because I've answered all the mandatory questions. I can go down to the bottom and press save, and it closes that section. And from here, you could save and come back to it later, or you can continue to fill in the other sections of the form. So what we'll do is we'll start to fill out the next section of the form, which is around what essential principles our devices are non-compliant with. So here you need to identify all the essential principles that the devices are non-compliant with. You'll need to select one EP at a time and then provide details as to why the devices are non-compliant with that EP. So to do this, I click on the Add Breached Essential Principle button. This will open up a new window in the current view for me to select in numerical order which EP I'm going to choose first. So you might need to scroll down a little bit to find the EP that's relevant to you. So say, for example, our devices have non-compliant picks and pills. The first one that we might choose is 13A2, patient implant cards. So I select that, and here I need to provide the details as to why our devices do not have compliant picks. Once you've done that, you need to press save and close for this to be added to our application. So you can see here, but by saving and closing, we've got the EP 13A2 added to our table and also our explanation as to why the device does not comply. We now might want to add a second one. So if we've also got non-compliant pills, we would add another breached essential principle. We would scroll down until we find the one that's relevant to us, select it, and then provide the details. And then hit save and close. And then the table will be updated with our second essential principle. So you can see here that I'm adding one essential principle at a time so that I am able to provide the explanation as to why the devices are non-compliant, but I can add as many essential principles that are relevant to this application. If you decide that you want to edit the information that you've put in, you can simply select edit from the drop-down arrow button here. It will bring it back up, and maybe you can add some more information or you can delete some information. So it gives you the ability to add here, and you can just press save and close. In addition, if you decide that that wasn't the right EP, you can also delete that from the table using the delete function. Once again, if we've finished selecting all the essential principles that our application is relevant to, we can hit save, and this will save our information, bring us back to the front screen, and from here we can either leave and fill this in later, or we can continue with the application. So let's continue. We're going to choose device groups. So here you can create a group for all the devices within the application that have the same proposed start date and proposed end date for the consent period, and also the devices that have same implementation plan. For example, if you have 20 devices, which can be ARTG entries or applications for inclusions, of which maybe 5 devices have the same proposed start and end date for the consent period and the same implementation plan, these 5 devices can be grouped together into this application. Similarly, the remaining 15 devices can also be grouped by start and end dates and implementation plans. You must have at least one device in a group, and you must provide at least one group. There is no limit to the number of groups that you can create, but yeah, you must create at least one group, and each group must have at least one device in it. And please also note that you cannot have the same device as included in multiple groups. You can only have one, the same device in one group only. So let's go ahead and create a device group. We can do this by clicking on the Add Device Group tile here. This will open up another window within the current view for us to provide a name for our group. We can name it anything we want, and as long as it's relevant and meaningful to you to be able to differentiate the different groups that you may have within your application, you can name it what you want. Here, we just save and close the name for our group. By doing that, you can see here that the name for our group is now appearing in our group table. But you can see here that we're yet to enter any devices. So now we use this button here to press edit, and this is where we're going to add in the devices and our start dates and stock information for this group. So you can see here that this has opened a new window within the current view for us to start adding some devices. You can see this validation error here. This will stay until you add at least one device to this group. So to begin with, we can select what ARTG entries are part of this group. And remember, you can have ARTG entries and applications for inclusion, or one or the other. But because we've selected both in this application, we're going to put both into this group today. So to add an ARTG, I simply click on the Add ARTG buttons, and it opens another window within our current view for us to select the ARTGs that are part of this group. We can do this by ticking in the boxes provided, just by highlighting them. You can untick if you've made an error there, or you can also search and you might decide to search by class. So say, for example, well, let's go class 3. Then that should demonstrate the class 3 device, and we can select it there. Once you've selected it, you can just press add down here, and that will add that ARTG to the group. And you can see that before we did our search, we had already selected a couple of ARTGs. So these are the ARTG numbers now that are part of this group. And if we've made a mistake, we can remove one of them from the group. It will come up with a confirmation that you do want to remove that ARTG. Simply confirm, and it will remove it from the group. The next section is where you can add your applications for inclusion and then provide stock level information if relevant. So to add an application for inclusion, I simply click on the application for inclusion button, which will bring up another window within the current view for us to add in the application number. So here you would add in your application number, which is generally in a format similar to this, and then provide the device name. These are mandatory fields, so you must provide a device name and the application number. Then just hit save and close. And then you can see now we've got our 2 ARTGs that we selected, and now we have our application for inclusion also included in our group here. So now, if it's relevant, we can also go in and enter stock information. So here at the ARTG level, we would click on edit, and this will bring up the box to go and start providing stock level information for this particular ARTG entry. So you can see that it has the ARTG name here, and we can provide stock level information. So you're just typing in a numerical value here because you're going to indicate what the units of measure are in another field. So current and future you can fill in, and this is where you're going to say what those units of measurement were. So it might be a box, a pack, each. If you do select other, this is where you just need to specify the number of devices in that unit that you've selected. So you might decide that you might have packs of 2. So you'd just choose other and put the 2 in there. Here, you can provide the expected depletion date of stock by clicking on the calendar icon. It will bring up a calendar. You can scroll through to the date that you expect all stock to be depleted, choose the date, and then move to the next one. This question is around whether there'd be any supply shortage if the consent to supply is not granted. Here you can choose yes, no, or unsure. If you choose yes or unsure, then you'll need to provide an explanation as to the supply shortage. So you can just type the information in here. There are a couple more questions. One is around the additional impact to Australian consumers if the consent is not approved. You might like to provide this information as an additional reasoning for your consent application. You can choose yes, no, unsure. Like the question above, if you choose yes or unsure, a box will be provided for you to provide your explanation. Once you've filled in this information, you just press save and close. And then you can see here that our table has been updated with our stock level information. So you can move through these ARTGs and add our stock level information for each one. If you're seeking consent for a long period of time, it may not be relevant to have stock level information. And you can see that a lot of the information is not mandatory. The device name has already been provided, and you can see that there's no red asterisks for these questions. So once we're happy with that, so we've got all our devices in our group, we're happy that we've filled in the stock level information that we want to provide. This is where, for this particular group, we now need to nominate our proposed start date and end date for the consent period. So here you simply click on the calendar icon and select the date that you wish to start the application for consent. So let's say we wanted to go December 15th, you just select that date, and perhaps we want to go through to May 2023, you can just select the date there. Please note that the start and end dates must be within 3 years of each other. Here, you need to provide a reason for the duration. So you just type in your reason there, and you can see that that's a mandatory field. And the next box is, sorry, for batches. Now, once again, for periods of consent or applications for a long period of time, batch numbers may not be relevant, but if you're seeking consent for a short period of time for a small number of devices, then it might be relevant here to provide the batch numbers. The next section is around the strategies to rectify the non-compliance. And this is where you must provide an explanation around the strategies to be implemented or proposed to be implemented to rectify the non-conformance for this group. And this is where you would either upload some documents from your computer, or you might be able to provide details in the box here. But if we're going to add some files in here, what I'm going to do is I need to write documents attached or document attached so that we know that there are documents attached. Once again, if I add on the add files, I can select on the choose files button. It should bring up your computer. I can select the implementation plan here, select it, and then press add files. And you can see here, so the implementation plan, actually, if I just go back up a level, these folders will appear before we upload a document, but I noticed that when I did that, that hadn't done. So let's actually put it into this folder here. So we want to put our implementation plan into the implementation folder. So I can click on that and add files. Choose it. So let's put that implementation plan into this implementation plan folder. It's not the end of the world. If it goes into the wrong folder, we will find it. It's all good. So let's select that. And you can see here now that that's got that document there. To go back up, we just press the up arrow button, and this is where we would also be able to upload a copy of our interim PIC and perhaps our interim pill if we have selected devices that are non-compliant with EP 13A2 and 13A3. This is where you provide it. Now, for the documents that we upload, we've got a 50 megabyte file size limit, which hopefully is enough. And you can provide this in Word format, PDF format, or Excel format. We are running a survey for this form. If 50 megabytes turns out not to be enough, then you can give us that feedback and we can look at upping the file size. But hopefully, if you're separating out the documents into across groups and providing them separated by PICs and pills, then 50 megabytes should hopefully be enough. So once we've done uploaded our documents, and we've also written in the box that we have attached our documents, we simply save and close all this information. You can see now that our device group section has gone green, and this is because we have got all the information that we need for at least one group. So here you can see we've got our group name, the ARTGs linked to the group, our application for inclusion numbers, our proposed start date and end date, and the date that we created it with the time. This column here just indicates that we have completed all the information that's required for this group. If we want to go back and edit anything here, we've got the ability to press edit and go back and edit, or alternatively, if we've made a big mistake and we want to do that, we could delete this application here. So if we want to add a second device group, it's simply pressing on the add device group and going through the process again, selecting the ARTGs, the applications for inclusion, the start and proposed date, and so forth. So once we've done that, the next section is to provide our declaration. To do so, we just open it up, read the declaration, obviously, and then if you agree with the declaration and you have submitter permissions in your TBIS profile, then you can tick the declaration and then press submit. If, however, you're a drafter or you're not quite sure yet, you can simply save the information that you've done so far to come back and submit at a later date. The application will stay in the draft draft application view until you've chosen to submit. So let's submit it. So I've read and I agree with the declaration, and now I'm going to submit the application. So it's just processing. My internet's a little bit slow. Okay. And now it's returning us to the front screen where you can see here that our CTS number here is now in the consent application view rather than in draft, because we have submitted it. And you can see that I was a submitter and it was submitted during this time. You cannot, once you've submitted it, you are unable to edit a submitted document because it becomes a legal document. If there's any really dire circumstances that you need to speak to us about it, of course, you can contact us and just quote the reference number and we can help you with your inquiry. If you need to print from here, you can simply click on the application here. Click on the application details, and this will take you to this view where you can scroll through and see all the information that you have provided and the documents that you have uploaded as part of this application. If you need to print, you can right-click in the middle of the screen here and press print. And by doing so, it will bring up the option to save as a PDF up here or save as a file onto your computer. In the next release, sometime in the new year, we will have a print function from the dashboard. But in this release, you can still print, you just need to do it through this way. So we'll just cancel that out. If you need to return to the home screen, you simply click on the dashboard again and it will return you here. Okay, I'm going to stop sharing my screen now and we'll just go back to the slides. We're just going to talk a little bit about the application fees. So once you've submitted the application form, you'll need to pay the application fees. Applications for consent cannot be processed until all applicable fees have been paid in full. Now, the current fees for applications for consent to supply apply to each ARTG entry and application for inclusion included within the application. So the fees are $500 for the first ARTG entry or application for inclusion, and then $100 for each subsequent ARTG entry or application for inclusion within the application for consent. So say, for example, your application for consent has 55 ARTG entries. $500 is applied to the first ARTG entry and then $100 to each of the remaining 54 ARTG entries, which equates to the application for consent costing a total of $5,900. But consent to supply that only relates to non-compliant information materials, or EP13A, has a different risk profile, assessment and follow-up when compared to consent applications relating to other essential principles. So on the 29th of October this year, amendments to the Therapeutic Goods Regulations 2002 came into effect, providing reduced fees for applications for consent to import, supply or export devices that are solely non-compliant with 13A. The new fees for these applications is now a flat fee of $30 for each ARTG entry or application for inclusion within your application. So this means for an application for consent related for non-compliance only related to Essential Principle 13A, where there are 55 ARTG entries, the total cost would be $1,650. In terms of paying application fees, there are two ways to pay. One is an immediate payment, and that's where you have to calculate the total fees yourself, and then you can pay immediately after completing and submitting your form using a credit card on the TGA website, and I'll show you that in a minute. The other way is to pay against an invoice. If you require the TGA to raise an invoice for payment, simply complete and submit your application for consent in TBIS, and then the TGA will raise and send the submitter an invoice for the processing fees. But if you do wish to make an immediate payment, which is the quickest way, You need to calculate the total fees for your application based on the number of ARTG entries or applications for inclusion, and the current fees being $500 for the first ARTG entry plus $100 for each of the remaining ARTG entries as described in the previous slide, or if it's for an application solely related to EP13A, it's $30 per device within your application. Then you need to go to the TGA payment page, and we have the link there, and this is also a link in our guidance document. In the biller code, you need to choose option 9, exemption under S41MA. Then enter your client ID in the box provided. Then in the box where it says ARTG number, you simply provide that CTS number that was generated when we developed the, when we drafted the application. So that's that reference number. So you just need to put that reference number in the box, and then we'll be able to know that that's your application. Enter the total number of fees that are to be paid, select the payment method, so that is the credit card, and then follow the instructions to complete the payment. Once the fees have been paid, the post-market team will receive the application. If insufficient information or documents are provided in the application, you will be emailed to provide any missing information. An email with the consent to supply decision notification will be sent to the submitter to inform you of what the outcome of the consent application is. During the period of approved non-compliance, you may be required to demonstrate evidence that you are following your approved implementation plan. Please be aware that consent may be withdrawn at any time if there is non-compliance with the approved implementation plan, or if the implementation plan is audited and deemed insufficient to mitigate the non-compliance. If there are concerns regarding the implementation plan, you will be provided with an opportunity to amend the plan and address any concerns identified. At the end of the consent period, you will be required to provide a submission regarding the compliance of the devices to all of the essential principles. Okay, so now what we're going to do is we're going to have an opportunity to answer some questions. One of our team members, Dipti, is going to ask me some of the questions that are in, and hopefully we'll be able to answer some of your questions. And like I said, any questions that we're not able to get to, we will follow up.
Sure. Thank you, Kate. So the first question is, how will TGA police who has consent for non-compliance with Essential Principle 13A from those sponsors still waiting for manufacturers to finalize their pill? Will the TGA audit picks and pills?
Sure, thanks, Dipti. Well, all devices can be subject to post-market review, and as part of a post-market review or investigation, the TGA may request evidence of compliance with any of the essential principles. So in addition, the TGA may receive reports from patients or healthcare professionals that they have not received a pick or pill. And in those cases, it's very likely that the TGA will follow those up with the sponsor to make sure that they're being provided or consent has been sought and what the implementation plan is.
Thank you, Kate. Our next question is, can we supply pill in form of QR code on the retail box?
Sure. So as you might be aware, on the 29th of October this year, amendments were made to the regulations to allow more flexibility in the way that patient information materials are provided. And one of those ways is around electronic picks and pills. And the big thing here is that these patient information materials need to be made readily accessible to the patient. Now, given in our new COVID world, we use QR codes to go to the shops, to go to restaurants and supermarkets, we would say that QR codes are a readily accessible way to information. So if the QR code was provided on the box with the device, then I'd say that that's a readily accessible way for a patient or a healthcare provider to be able to access the information. If that QR code took them directly to that information, then I would agree that that is readily accessible.
Sweet. Thank you, Kate. Next question is, are we still permitted to use the TGA paper-based proforma for the consent for non-compliance, or do we need to use the online form in the TBIS sponsor portal?
Yeah, sure. So, yeah, you really do need to apply through the TBIS portal. You might notice that there are additional questions there and information that we require for monitoring implementation plans. It's also easier than the paper form. So yes, on 1st of December, even the consultation hub forms that we have available right now that a lot of people, that everyone is using to fill in for their consent for their patient information materials, that will also be switched off and all applications will go through TBIS. And we hope that this is a nice streamlined way to be able to do this. We will also have a survey going, and we will have a link to the survey from from the TGA website in our guidance document that will step you through all the things that I just took you through. And the survey will ask for some feedback because we do have more releases and functionality planned over the coming months to further enhance and integrate the form into the services.
Thank you, Kate. Next question is about the time frame for processing these applications. So we have received a lot of questions on that. So I'm going to consolidate into one question.
Sure.
The question is, what is the time frame for processing applications for consent?
Yes, and this is a really good question. So the TGA is unable to process any consent applications until the fees are paid in full. So it really does depend on the payment type. So if you make an immediate payment with your credit card, that will kind of expedite things a little bit. If you need an invoice to be raised before you pay, then the TGA, the standard processing time is around 48 hours of working day, so 2 working days to raise and send the invoice. And then, of course, it depends on how long you take to pay the invoice. If you pay immediately as soon as you get it, then we need to wait for that money to appear in the TGA bank account before the team can go and review the application. So really, it's the financing, just the standard financing and banking things. So we do suggest that you submit your form at least a week or 5 working days prior to when you would like the consent period to start. And we suggest that if time is really important to you, that you, and you're paying via invoice, that you pay that invoice immediately as soon as you get it. And if you make a payment on the weekend, it's not going to appear perhaps in the TGA account till Tuesday. So, and if you pay after 5 p.m., it also affects it. So really, the hold up would be in the payment method that you choose. So I'd give it at least a week.
Sure, thank you. Next question is around the consent application again. Is there a possibility that the consent will be rejected?
The TGA will work. Yes, it may not be approved if, the TGA wants to work with sponsors. So if the information that's provided is not adequate, we will contact the sponsor to work with the sponsor to try and get that information. Now, obviously that the back and forth of working with the sponsor may add time onto the application. But if evidence is, if they're not able to provide an implementation plan and risk mitigation strategy that would satisfy the requirements that we know that patients are able to access this information in the interim until fully compliant device is available, then it is a possibility that the application may not be approved.
Sure. Thank you, Kate. The next question is, do I have to wait for the consent application to be approved before continuing to supply affected devices that do not have compliant patient information materials after 1 December 2021?
Yes, that is a good question. So if you want to continue supplying post 1 December for devices that are being supplied after 1 December, yes, you must have that consent in place. So the consent must be in place on or before 1st of December to ensure a continued supply of the affected devices. So that includes the payment of the fees and approval of the delegate of the Secretary, which then involves the sponsor receiving a notification letter that actually specifies that the consent has been granted. If you do not have consent for these non-compliant devices in by this date, then you must stop supplying those devices until you have consent in place.
Thank you, Kate. Next question is there a time limit for the duration of consent for non-compliant devices? How long can we seek consent for? Sorry.
Sure. Yeah, no, that's a good
Yeah.
question. So in general, consent is usually granted by the delegate of the Secretary for a maximum period of 2 years. However, as there's a change in the Australian regulations for patient information materials prior to the European Union regulations coming into effect around non-compliant patient information materials, then the TGA will grant consent for these particular types of applications up until the 25th of May 2024, so that it aligns with the EU regulations. So usually 2 years, but for non-compliant patient information materials, we will consider up to the 25th of May 2024.
Thank you, Kate. Our next question is, this is also around the payment, fees payment. So if an invoice is requested by the consent, for the consent application, how long will it take for the invoice to be raised and sent to the sponsor?
Yes, so the standard turnaround time for raising an invoice by the TGA is generally 2 working days. So that's important if you're asking for an invoice on a Friday after 5 p.m. You know, it's 2 full working days.
The next question is, if the TGA approves the consent for an application for inclusion, will I need to inform the devices application section that it has been approved, or will the consent approval be provided internally to the devices application section?
Yep, sure. No, there is no need for sponsors to contact devices applications. So if the application has an application for inclusion as one of the devices that are affected, then you do not need to inform devices section of your application for consent. So the TGA processes will ensure that the devices application section are fully informed about the consent application and also the progress of the decision. The devices application section will be notified when, will be advised once the notification is sent to the sponsor. So there's no need for sponsors to contact devices application section in this regard. We will let them know.
Similar question, actually a subpart of the same question. If we have further questions while we are actually applying for a new application, then can we contact at mdconsent@health.gov.au?
Yes, so if you have any queries regarding the consent to supply process, you can contact us on that email, and our team will respond to you on that email for sure.
Thank you, Kate. The next question is, if the patient information leaflet is compliant, but the patient information card PIC is not, can we seek consent for non-compliant PICs only?
Yes, definitely. So sponsors can seek consent for non-compliant PICs only by selecting that specific essential principle within the that's related to PICs within the application form. And conversely, if it's you need consent for non-compliant pills, then you just select that essential principles within the application. So yes, you can do it for PIC only or pill only. It doesn't matter. You're just selecting the essential principle. And of course, if it's for devices that are non-compliant with both, then you can select both.
Well, thank you, Kate. Next question is, do I need to apply for consent if the manufacturer plans to release the devices with patient implant cards and patient information leaflets from 1 December 2021 from their side?
No. So if the patient information materials for those devices will be compliant on 1 December, when the devices are actually supplied, then consent for non-compliance is not required.
Sure, thank you. I think we should wrap up the question answer session now, and we'll try to reach out to all the sponsors or all the questions that we have received so far. Over to you, Kate, back again.
Thanks. Okay, thank you so much for joining us today. Like I said, we hope to have the new form up on Wednesday in TBiz, and this will be the first release of a number of releases as we look to improve the form. And as I said before, there will be a guidance document that steps you through filling in this form, available on the TGA website. On the Essentials Principles Non-Compliance page. And we also have frequently asked questions document up there too that will take you through some of the common questions that people have, so you can have a read of that. And like I said, yeah, we will have a look at any more of the remaining questions that have been provided today, and we will try to get back to everyone with answers to your questions.